Hello, everyone, and welcome to our webinar. My name is Anchisa, and I'm the moderator for today. I'd like to please ask our guests to also come onto the call and switch on their cameras. Lovely. Thank you so much. I'm delighted to be your moderator today. As the host of the Root of the Science podcast, I've had the privilege of exploring various scientific advancements. And today I'm excited to delve into the innovative health solutions transforming healthcare across Africa. This webinar is brought to you by The Conversation Africa in partnership with the Africa Health Tech Podcast and Global Health Strategies. The Conversation Africa is a website that works collaboratively with academics to share their insights with non-academic audiences. This is the first virtual event in the Conversation Africa virtual series, which runs every Thursday for the next month. So our objective today is to explore the transformative impact of AI-driven health innovations on the continent. We'll do this by looking at how these innovations are addressing health inequalities, and we'll discuss various health initiatives that are being implemented across the continent. As some of you are aware or might not be aware, but AI is rapidly transforming healthcare globally, and in Africa, it's not an exception. Although AI adoption in Africa is still in its infancy and developmental stages, but an analysis revealed that South Africa, Nigeria, and Ghana are leading in AI healthcare across the continent. The most common AI tools that are being used are deep learning neural networks in medical imaging and adaptive neurofuzzy inference systems. These AI-powered tools are enhancing diagnostic accuracy for diseases such as malaria, tuberculosis, and cervical cancer, which are prevalent across the continent. These tools are helping healthcare workers provide faster and more accurate diagnosis, even in remote regions where specialized healthcare is often lacking. Additionally, AI is playing a crucial role in public health initiatives by predicting disease outbreaks and helping manage resources more effectively. The African health AI market is expected to grow significantly, driven by increasing mobile penetration and the adoption of digital health solutions. This growth is supported by an ecosystem of health tech startups, innovative partnerships, and investments, both from public and the private sectors. To help navigate this conversation, I'm joined by an incredible lineup of panelists that are right here with me today. And I'm so excited to delve into this conversation. First, you will see that we have Professor Kelly Chibale. He's from the University of Cape Town and is a leading figure in drug discovery and development in Africa. We're also joined by Dr. Uzma Alam. She is from the Science for Africa Foundation, who will share insights on AI innovations in public health. Lastly, we have Herbert Barasa from Amref Health Africa, who will talk about strengthening health systems. Now, before we start our conversations, this is the part of the conversation usually where I would ask our wonderful panelists to introduce themselves. But today I thought we'll do something a little bit different because we are talking about AI. So I've decided to ask ChatGPT to introduce our panelists. We'll see how this goes, trusting that this works. So I'll start off with asking ChatGPT, may you please oopsie, sorry, technical difficulties. Let me try that again. ChatGPT, may you please introduce Professor Kelly Chibale from the University of Cape Town in 30 seconds.
Certainly. Professor Kelly Chibale is a distinguished professor of organic chemistry at the University of Cape Town and the founder and director of the H3D Drug Discovery and Development Center. He's a leading figure in global health, known for his groundbreaking work in drug discovery, particularly in the fight against diseases like malaria. Professor Chibale's innovative research has earned him numerous accolades, making him one of Africa's most respected scientists in the field of medicinal chemistry.
Thank you, ChatGPT. May you now please introduce Dr. Uzma Alam from Science for Africa Foundation in 30 seconds.
Sure. Dr. Uzma Alam is a key figure at the Science for Africa Foundation, where she plays a pivotal role in advancing scientific research and innovation across the continent. With a strong background in public health and development, Dr. Alam is dedicated to bridging the gap between science and policy to address Africa's most pressing challenges. Her work is instrumental in empowering African researchers and fostering collaborations that drive sustainable development.
Thank you, ChatGPT. Lastly, may you please introduce Herbert Barasa from Amref Health Africa in 30 seconds.
Of course. Herbert Barasa is a visionary leader at Amref Health Africa, where he drives initiatives aimed at improving healthcare access and outcomes across the continent. With a strong background in health system strengthening, Herbert focuses on innovative solutions that address critical health challenges in Africa. His commitment to enhancing healthcare delivery, especially in underserved communities, has positioned him as a key advocate for health equity and sustainable development in the region.
Thank you so much. So, Prof. Chibale, I'll start with you. Was ChatGPT correct in the way that they introduced you?
Well, ChatGPT knows me more than I know myself. Spot on.
Perfect. Perfect. Dr. Alam?
Pretty close, but I missed some data points.
Oh, okay. No, I'm sure you can clarify when you are chatting. Lastly, Herbert, how was the introduction from ChatGPT?
Yeah, it's made me look bigger than I thought.
I think you are a big deal. Thank you so much, everyone. It's lovely to hear. We are in the space of AI, and I thought it would be a really interesting way for us to start our introductions. Now, before we dive into the program, thank you for all of our audience who has joined us and would like to really hear from you. So just now, you'll see a live poll that will be popping up on your screens shortly. And I encourage you to please interact and so that you can share your thoughts on AI in Africa. This will set a really great foundation so that we can see where our conversation will lead, and will also help us understand your perspectives as we move forward in this discussion. So if you can just hold on a second for us, the poll should be popping up on your screen. Okay, so we'll run through the questions together, and I'm gonna answer it on my end. I'd also like for you to answer it. So the first question that we'd like to know was, when was the first use of AI in healthcare on the African continent? So the first choices, was it 1980s, was it the 2000s, or was it the 2020s? So you can select your option. I'll do the same on my end. Then the next question is, what is the main contributing factor to the limited number of clinical trials in Africa? So the first option is it a lack of policy, or no single regulator, lack of common ethics, or all of the above? Please may you select. Then last question was, do you think AI can be used to predict malnutrition on our continent? Here you can simply select yes or no. So once you have selected, we will wait to hear your results. We'll give you some of the people who might not have had a chance to do so. Just waiting for the results to show up. Okay, great. Okay, so this is the results. Most people said that for the first question, they said it was 2000s, 65% of you. Then the second question was, what is the main contributing factor? And most people has agreed that it's all of the above. The last question was, can AI be used in malnutrition? And the answer was mainly yes. So now these are some of the topics that our lovely panelists will really talk more in their discussions. But before we do that, I'll just like to remind you, in case maybe some of you have just joined us, that this webinar is brought to you by the Conversation Africa in partnership with Africa Health Tech Podcast and the Global Health Strategies. A reminder that you can also sign up for the newsletter daily or the weekly WhatsApp updates. If you missed it, there was a QR code at the beginning of the webinar, but keep your phone close, and by the end of the webinar, you'll be able to see it again. And also, there's another dialogue after next week, like the one that we're having, and it's titled Fixing Nigeria's Food Crisis, which is the challenges and the way forward. We'll share the links for that in the chat as the webinar continues. But most importantly, I really encourage everybody to please submit some questions. You'll see a Q&A box there as you listen to our panelists talk more in their discussions. This will allow you to engage directly with our panelists, and also your participation will really enrich this discussion. So please feel free to share your insights. Right now, though, we are going to start with our panel presentations. And the first person who will be presenting is Dr. Alam. Dr. Alam, over to you.
Thank you. If you just give me a second to share my screen.
Sure.
Can you see my screen?
Yes.
Okay. Just make that slideshow. Okay, so good afternoon and good evening, everybody. I'm delighted to be here today to discuss the pivotal role of policy in driving the AI transformation for healthcare on our continent. I'm Dr. Uzma Alam from the Science for Africa Foundation, where I lead our portfolio on policy and data science. So let me start by asking, is there only one form of artificial intelligence? And the simple answer is no. In reality, AI can be grouped into three different categories based on the capacity. So the first one is artificial narrow intelligence, and this refers to a form of AI that's specifically trained on one specific task, and then followed by artificial general intelligence. This is a phase of AI which is more currently under research and development and would have additional capabilities and more human-like capabilities such as learning. And then we have the ASI, which is the super intelligence, which is still work of science fiction, and we're not there yet. And then, and as you rightfully mentioned, within ANI, there are multiple applications within healthcare, anywhere from health diagnostics to telemedicine solutions to predictive analytics, medical imaging, and drug discovery. And one thing ChatGPT forgot to mention is that Professor Kelly is the leading thought leader on the continent on this. So I'm really excited that, he's going to be able to speak a bit more on this topic. And then if we look at the history of the use of AI in healthcare on the African continent, it actually started way back in the 1980s with the first documented case coming out of Kenya, where the Aga Khan Hospital and Nairobi Hospital used AI tools for patient-doctor interactions, and then through some of the more recent cases where the Nigeria CDC used AI to track the spread of the recent Ebola outbreak. So at the Science Policy Engagement for Africa Research Program at the SFA Foundation, we asked a simple question, right? So we asked, what are the top opportunities and challenges in using AI across Africa? And we did this through a mixed method study design, which involved 57 of the 55 Africa Union member countries, 450 different organizations, 800 plus stakeholders, who self-identified themselves as either experts or non-experts, and they ranged anywhere from policymakers, civil societies, researchers, innovators, and the private sector. And the leading answer, right, across the board, across country, across language, across expert, non-expert, was that the policy frameworks and policy space are going to be the top challenge for Africa in implementing AI when it comes to health. And then we also asked the second question and said, where could AI be most impactful in Africa? And clearly across again the board, the answer was health. And within health, there was pandemic preparedness, drug discovery and clinical trials, mental health, and the One Health approach. So why do we need these policies, right? And the simple answer is that the risk of AI in Africa is multifaceted, right? And this ranges anything from ethical and legal concerns such as, patient safety, compliance with health regulation, and data privacy. But within the African context, right, gender and equity issues are also of paramount importance because, data has already shown that technologies can worsen the gaps in inequalities. And in Africa, we need to keep a focus on this, especially recognizing that 50% of our population are women, and we have a number of high-risk population groups, such as our internally displaced persons. And then there's also this concern around misalignment with local needs, and this is mainly driven by the concept that a lot of AI initiatives are developed outside the continent, so they're not necessarily aligned to the context and the cultural needs. And then lastly, one of the biggest concerns, and this is just not Africa, but globally, is the bias, the inherent bias that's driven by AI trained on limited data, or lack of representation, whether it's ethnic representation, gender representation, and so forth and so on. So where are we, right? If we look at what's happening in across the continent and the policy space for AI, where are we, right? So the first thing is that across Africa, our legislative and parliamentary bodies are generally not active in AI governance, but they are active in data governance. And a case in point of this is the recent case out of Kenya on the WorldCoin saga. And then across the globe again, research and use of AI is increasingly ahead of governance. But within Africa specifically, we see there are a number of limited policy frameworks, especially for gender mainstreaming, right? And even when they exist, they seem to have more of a focus on providing STEM skills and coding opportunities for girls. There is a budget misalignment, and across the policy frameworks that we were able to sample, we found, varying gender equity ratings, with Sierra Leone actually having one of the better ratings at 0.04. And then for Africa, something really important, policy frameworks just missed the rural-urban divide. And this will actually have specific implications in the context of healthcare across our different countries. And lastly, but not least, health considerations get passing references when they do exist. And again, this is driven by, the frameworks that we were able to sample were mainly housed within ICT departments. And yet, I showed you data that across the board and across stakeholders, health was identified as a top impact area for AI. So having said this, right, what are the opportunities for AI on the continent? So firstly, a lot of our public universities, especially in around South Africa, Kenya, Egypt, Tunisia, Nigeria, Morocco, are starting playing key roles in AI and R&D. So there's an opportunity to link these to regulatory sandboxes. And if we just see the figure on the right, the bar chart, so this is data from a study we did with our partners, Africa the Africa Cochrane research. And this was a bibliometric research looking over the last 10 years, looking at corresponding author countries in relationship to AI and global health. And, amazingly, 42% of the countries represented, here are from African countries, including some of, the lesser known players within the space, such as Benin. Right? And then one of the biggest advantages we have as a continent is that there are a number of existing frameworks that can be leveraged. 43 of our 55 Africa Union member states have data protection acts that, we can update to offset some of the biases we've already spoken about. We have the Malabo Convention. This is a convention that's more than 20 plus years, and it allows it shares a framework for data sharing across countries. And more importantly, it's very embedded within our sub context. For example, it recognizes the need not just for regulation, but, equitable development across the different countries. And then we all know the Science, Technology, Innovation Strategy for Africa 63 that's rolled out in 10 years blocks, the 24 years, the last 10 years blocks coming to an end. We're looking forward to STISA 34, and the recommendations already coming out from these conversations are, African countries need to have a focus on emerging technologies and particularly AI. And in line with this, the Africa Union out NEPAD has already put forward a blueprint for this regulation. And then excitingly, right across the continent, we have a lot of political will. So, for example, Kenya, Uganda, and Mauritius have already put AI agencies or, oversight bodies into space. And, the debate's still out there if this is a good thing or not. But, it's a start. And then there's lots of national funding that's going on, especially around Mauritius, Nigeria, and Rwanda that have actually built national programs in partnership, but also, supporting it through national funding mechanisms. And then Egypt, Ghana, and Rwanda are a bit ahead of the curve when it comes to policy frameworks with national strategies for AI already in place, but, they need to start focusing more on the health aspects as we've discussed. And then Kenya, Nigeria, and Malawi, which are countries that we are supporting, have ongoing developments around AI policies, right? So what are the future trends? So we've already mentioned, the importance of gender considerations when it comes to AI in healthcare. And then we've also mentioned this ecosystem approach where policy needs to keep up with the research and development. But important in here is, ensuring that we ring fence funding for science policy. Otherwise, it would be just like any other innovation that, develops and then regulations and afterthought. And for AI, given the risks, this model just wouldn't work. And then when it comes to data, the use of data for AI training sets, from the African context, it's really important that we start integrating the social sciences and arts, but also our knowledge, local knowledge sets into these data sets. And then lastly, but not least, recognizing that AI, the conversation around AI policy and regulation is so heavily Western driven, and also, it's something of national security and plays at a higher level. It's important that, beyond research and development within Africa, we actually start strengthening science diplomacy. And then I've been saying we, who are we? So we are the Science for Africa Foundation, like I said, and, there's a big team behind this work. And our mission is to catalyze and strengthen Africa's science and innovation ecosystem. And the 4 words for our the way we work are prioritizing. So we convene African leaders to understand what are the challenges and gaps that are solvable through an R&D on the continent, and then we design programs to respond to these priorities. We align it with funding to ensure that impact is delivered on R&D, and then lastly we provide oversight. And with that, and I will stop and hand back over to you. Thank you.
Thank you so much, Dr. Alam. Thank you so much for, setting the scene and setting the foundation for our conversation, giving us the history and also talking us through the policy frameworks across the continent. and really exciting to see what the future trends are for AI in our continent. Right now, I'd like to please ask Professor Chibale to please come on for his session.
Thank you very much, Anne. Can I just confirm that you can hear me clearly?
Yes, we can.
Excellent. Thank you very much indeed. Thank you. Yeah, I guess after the opening address by Dr. Alam, I think it's laid the foundation for policy aspects, et cetera, et cetera. What I'm going to focus on is basically two aspects. First of all, how AI can be used in the discovery of new medicines and also in the development of those medicines once they're discovered. The second part of what I'm going to address is how AI can be used to tailor treatments for specific populations. In this case, the African patient populations. So those are the two things that I'm going to deal with in my 10 minutes or so of my presentation. So the first part is, how can we use AI to advance the discovery and development of new medicines? I think before I even get into that, I think what's important is for me to just spell out the process of discovering a medicine. And this really goes as follows. The starting point to any program to discover a new medicine starts with identifying what the disease is. So you go to the doctor, you describe your symptoms, and based on what you say to the doctor, the doctor will order some tests, and then based on the test results, determine what you're suffering from. When it comes to drug discovery, depending on the approach you take to discover a new medicine for that disease that's been identified. So there are two general approaches to discovering a medicine. One approach is what we call a target-based approach, and I'll come back to this a little bit later. The second approach is what we call a phenotypic screening approach. So the phenotypic screening approach, which I will not deal with in much more detail because I want to spend time on the target-based approach, simply requires you to take a collection of molecules, whether they come from nature, whether they are chemical libraries, and you screen them on the cell that you're addressing, whether it's a cancer cell or a malaria parasite. And then you identify molecules that kill the parasite or the cancer cell in a way that is really selective, that there's no toxicity to the human host. And then you optimize that molecule with respect to safety and efficacy, and then you go on to clinical trials. The target-based approach, on the other hand, requires the identification of what we call biological targets or drug targets. So the advances in molecular biology, biochemistry allow us to do genetic studies that can really identify which protein or enzyme in the disease-causing organism in the cell that we can interfere with to basically ensure that we can kill either the parasite or the virus. So that process is what we call target validation. So you select a target and then you can validate it. Once you find a target that is validated, where if you knock it out, then the cell must die, you then screen chemical libraries, so whether they come from nature or wherever they come from, to identify what we call lead molecules. Once you identify lead molecules that act on that target, you then test them on that cell which they come from, whether it's a cancer cell or a parasite or a virus. And then you optimize that molecule, that lead molecule. Then you basically do preclinical studies. And if those are successful from the perspective of efficacy and safety, then the drug or the therapeutic or the vaccine enters clinical trials. Then you do phase 1 clinical trials, phase 2 clinical trials, and phase 3 clinical trials. So that's a general value chain. And I can tell you it's a long process, it's an expensive process. And we say in the process of discovering a medicine and developing it, you have to kiss many frogs before you meet the prince because the success rate can be quite low and it's very risky. Okay, now where can AI actually impact. So you can actually use AI at any stage of this process that I described. You can use AI to speed up the process of identifying the target, but also use AI to help you efficiently validate that target so that you select a target to go after that is going to be a lot more effective and will make the disease-causing organism or the cell more vulnerable to chemotherapy or vaccine interventions. So that's one application of AI in terms of identifying and validating a target. But we can also use AI to basically, in the stage where we're trying to optimize the lead molecule, we can use AI to develop models that allow us to predict which molecules we should make. So we don't have to make many, many things, but we can build these models that allow us to say, these are the molecules you should make because they'll give you the right efficacy profile and the right safety profile. So that's how you can use AI. You can use AI also when it comes to designing clinical trials, selecting the right patients so that those clinical trials are really, really are successful, but also that they are safe and efficacious. So that's broadly speaking how you can use AI to really speed up the process and intervene at any of these stages I described earlier. Now, this is all what you can do generically, but what have we actually done ourselves in Cape Town? And that's what is important. You know, it's not talking about what is possible, but what have we actually done using this approach? And I can tell you very briefly one project we've undertaken. Our Drug Discovery Center, H3D, we have been going for the last 13, 14 years. And over the years, from our various programs, we've generated a lot of data, a lot of data. One of the things that underpin AI is data. You need to have granular data that you can use to build models that are predictive and are accurate, that you can rely on. And so what we did is, a couple of years ago, we really took on this AI project to build AI models across the entire portfolio from the different types of assays and experiments and data that we've accumulated from all our drug discovery programs over more than a decade, and built models that we are now deploying with so much efficiency that have improved our efficiency in our process by 40%. So this is actually not just something you read about. This is something that we've actually been able to demonstrate that when you have reliable data, granular data, you have access to high performance computing, and you have a reliable internet, you can really utilize AI and make a difference. So that's the first part of using AI in advancing the discovery and development of new medicines. And I've given you an example of how we have used AI to improve efficiency in the entire processes that we go through in our drug discovery process by 40% because we were able to build models from real world data from our programs. The second approach is using AI to tailor treatments for either individuals or for populations. Now, of course, one of the things that is important about how people respond to medicines, one of the reasons there's such a huge variability in how either populations or individuals respond to therapy, whether it's vaccines or antibodies or biologics or small molecules, is essentially as a consequence of genetic differences in the expression and activity of what we call drug metabolizing enzymes. And so you can find that you can categorize people into either being normal metabolizers of a drug or fast metabolizers of a drug or slow metabolizers of a drug. So clearly, if you give the same dose that you give a normal metabolizer, however you define normal, if you give that same dose to a slow metabolizer, you will effectively be overdosing them. And if you give that same dose that you give to a normal metabolizer, you give that to a fast metabolizer, effectively you'll be underdosing them. Then of course you won't see the desired effects. So what AI can do in general, at the level of genomics, trying to understand what is the impact of genetics on the response to therapy, that you can use AI to analyze a lot of genomic information and pinpoint which genes are involved in the metabolism of medicines and which of those populations or individuals have mutations in that gene, so that you can then tailor drugs for that specific genotype, so to speak. Now, how can I reduce this to practice as an example of what we are actually doing and have done here in Cape Town? And this is an example and the story of a project called Project Africa Gradient. This is a program that we've been doing with the two innovative pharmaceutical companies, GlaxoSmithKline and Novartis, in partnership with the South African Medical Research Council. And we have been supported through this program to use AI to stratify genotypes that are prevalent in Africa, that are likely to affect the metabolism of malaria and TB drugs. Essentially, what we've been doing is to use AI to identify genetic variants that are prevalent in Africa, that are likely to affect the metabolism of malaria and TB drugs. We then take the effects of these genetic variants identified using AI and incorporate them into mathematical models that are used to predict the human dose before you start clinical trials. So by doing that, we've been able to propose tailored dosages for people who carry specific mutations in these genes encoding for drug metabolizing enzymes. And then, of course, this is the kind of information that could then be useful in designing clinical trials so that you can give the right dose to the patients or participants depending upon their genetic makeup. So in a nutshell, that is basically what I've been able to describe how AI has been able to advance drug discovery and development. And I've given you an example of a real life project we've done. Secondly, I've also been able to exemplify how we are using AI to tailor drugs for the African patient population. Thank you so much. And Anne, back to you.
Thank you so much, Prof. Chibale. Thank you so much for your insights. And yeah, the practical insights of the research that you are actually doing at the University of Cape Town. It's pretty interesting to hear about some of the data that you've collected and how useful it is for future clinical results. This is a reminder to our listeners that please, we encourage you to keep on sending the questions to our panelists. We can see some already in the Q&A. So if you have follow-ups that you would like to ask Prof. Kelly or Prof. Dr. Alam, who's already spoken, please continue to do so. Now I'd like to hand over to Herbert, who would do his presentation, which will start off with a video, and then he'll come on to the call. Thank you, Herbert.
Amref serves over 24 million people within Kenya, and here we focus on intervening towards ending malnutrition for children.
Kinango sub-county is a semi-arid sub-county where we have erratic rainfall. Most of the times, the crops planted, the rains do not sustain the crops to maturity. And this leads to food insecurity. And because of the food insecurity, we have high cases of malnutrition.
Malnutrition is a problem at Kinango. I wish for my kids to have a better life and healthy one. That's why preventing is the better solution than treatment.
Currently, we have a lot of data. We have data for weather patterns. We have nutrition clinical data. This amount of data, as one person to make meaning of it, it has been taking a lot of time.
To improve the way we work, we are developing a food nutrition dashboard as a collaboration with Microsoft.
The food nutrition dashboard aims to utilize resources like satellite imagery, which helps us to understand more about what's going on the ground. Those include climate change and sustainability-related issues. But critically, at AI for Good Lab at Microsoft, we develop it using Microsoft AI technology. It has different flexibility. It gives you the risk of malnutrition across Kenya, across different time horizons in the future. The food nutrition dashboard could be actually calibrated to address different and future humanitarian crises. For example, flooding in Kenya.
Microsoft AI has brought on precision in terms of how we look at data. The dashboard can easily tell you where the cases of malnutrition are going to occur in the next coming months.
With the data, I'm able to predict the trend of malnutrition. And if it's on the increase, I'm able to mobilize resources, and we are able to come up with interventions to prevent the malnutrition from occurring. And when we prevent that malnutrition, we are able to save life of the child. When I save that life of that child, I feel good because that is somebody's child.
I'm happy because my kids are healthy, my family is healthy, they're not malnourished, and thanks to Amref, I even made them more healthy. So it has really supported that mother like me.
Yeah, thank you. Thank you for the video. It's a privilege to talk to all of you. And today I want to focus on health system strengthening in the focus or in the context of Kenya as a country. Disease burden tends to change, and Kenya is seeing a new trend in terms of the kind of diseases that it's grappling with. There's a lot of non-communicable diseases coming up. So there's so many things that currently the country is doing to strengthen the health system. As you may have heard, the issue of universal health coverage. Currently, Kenya has rolled this program out just to ensure that we have equitable and quality services that are focusing majorly on the marginalized communities, yeah, and also now bringing the services to all the people in the country. There's the issue of devolution. Kenya has devolved issues of health. This has led to strengthening decision-making and also expanding the coverage, especially when it comes to infrastructure at that local level, just to ensure people can access services. In terms of sustainable financing, Kenya also is doing a lot. It has rolled up a national health insurance fund that is looking at ensuring that all people are covered under this so that they can access services. I'll focus on two areas for today. The first one is looking at the issues of social determinants of health, which also comes in key in terms of solving the health issues of our country. So there's a more concerted effort to focus on issues of education, issues of environment, yeah, when it comes to health. So lastly, I'll talk about issues of data. Most of African countries have, in one form or another, a health information system. We are collecting a lot of community data. We're collecting a lot of health facility data. So how are we using this information? So as Amref, we have come in to make a deliberate decision to use artificial intelligence to assist us in how do we make meaning of data that is available. So today we're focusing on issues of nutrition, malnutrition in the country, just as so many African countries. Kenya, if you narrow it down, it has diverse climatic condition. There's the northern part of Kenya, which is arid and semi-arid. So currently, the figures when it comes to malnutrition, stunting is at 18% of children under 5. Underweight is at 10%. This is national average. Wasting is at 5%. But if you narrow down to counties, it goes up to even higher to 32%, 28% for counties that are in the arid and semi-arid areas. So we looked at why can't we use artificial intelligence to assist us organize data that is focused on reducing malnutrition. So we looked at what is available. Most countries, just like Kenya, we have outcome data on children, especially what we call the mid-upper arm circumference, the MUAC. Data is available, showing the conditions, if it's moderate, if it's severe, this data is available. Clinical data that we collect and put and upload in the health information system. Data on underweight, data on even levels of hemoglobin, diarrhea cases, all this data is available. So we sat down and looked at what is the other complementary data do we need? Then we realized there are open sources that provide climatic data. So we looked at what we call the moderate resolution imaging spectral radiometer from the NASA satellite. So this data is open, you can use this. So through modeling, we have developed a nutrition dashboard. So through artificial intelligence, this dashboard can predict malnutrition up to 6 months. And the good thing with this dashboard is it narrows down to that specific county and even a sub-county. So a small area, it can predict in the next 6 months, how many cases of malnutrition can you expect? So from this, we have gotten very good feedback from the counties and sub-counties in terms of their planning, in terms of how prepared are they, especially when we have changes in the weather patterns. So we're looking at moving this kind of modeling and using artificial intelligence also in other fields. We're looking at issues of supply chain management. Can we also improve this using artificial intelligence? And also in terms of maternal health. We still have very high maternal mortalities in Kenya, and is an area that we're also exploring. How can we use artificial intelligence to hasten data analytics that can improve the health of our mothers? So I'll stop at that, but the big picture is AI is coming in to really assist in issues of health, and it's giving us very good outcomes in the shortest time possible. Thank you.
Thank you so much, Herbert, for your presentation and that really inspiring video. I'm hearing from the people who are affected positively by the work that you are doing at Amref. It was really, really touching. And it's quite interesting to see what's happening in Kenya. At this point, I'd also just like to thank the other panelists for their inputs, Dr. Alam, Prof. Kelly Chibale as well. We really have spoken where we got the foundational aspects from Dr. Alam, and then we had some practical examples with how AI is helping in healthcare in South Africa and Cape Town, and then now here in Kenya. Thank you both. So right now, before we transition to the panel session and the Q&A session, I'd like to play a short video from one of our panelists here. This video will come up on your screens just now.
Welcome to the Africa Health Tech podcast, where we explore the exciting intersection between artificial intelligence, or AI, and healthcare in Africa. Join us as we delve into how AI is revolutionizing disease diagnosis, the discovery of new medicines, and the delivery of healthcare across the continent of Africa. I am your host, Kelly Chibale. I'm a professor of organic chemistry at the University of Cape Town, where I hold the Neville Isdale Chair in African-centric drug discovery and development, where I'm also the director of the UCT Holistic Drug Discovery and Development Center, also known as H3D, where we focus on the discovery of new medicines for malaria, tuberculosis, and antibiotic-resistant microbial diseases. Please join me as I speak to Africa's most eminent and pioneering scientists as we explore how technologies like AI can be brought to bear as we tackle some of the most significant, most pressing health challenges on our continent.
Thank you so much. So that little soundbite was a sneak peek of Prof. Kelly Chibale's podcast called the Africa Health Tech Podcast. So this is an announcement that it's being released. So if you really are enjoying this conversation, or you'd like to hear more about conversations that center around AI in healthcare, this is a podcast to listen to. It engages key experts on the matters of AI and health innovations, and it is a 3-part episode series launching this month in August, and it will spotlight AI in healthcare. It will cover advancements and the use and the role of technology. And it also delves into the research that's actually being conducted on the ground by African scientists and institutions. You can listen to this podcast on Spotify. So now we're going to transition. Yes, a round of applause. Thank you, Dr. Ala. Now we're going to transition to the Q&A session. So this is the part which I'm sure all of you are here to really engage with our panel and to really ask them some of the questions. Like I said, we are seeing some of your questions that are already in the Q&A. Please continue sending them in the chat box. So I'm going to start us off with the first question. This question is directed to all the panelists. So the question that I have is that, AI is something that is seemed to be new and modern, although Dr. Alam has told us that it started way back in the 1980s. I wanted to ask each of you to kindly reflect on how AI innovations might work alongside traditional methods that are already in play, particularly in your specific areas of expertise. So I'll start off with you, Dr. Alam, in terms of policy. Then Prof. Kelly, I'd like you to speak on the idea of the drug discovery, and then you to Herbert later on. You can then talk to us in terms of the nutritional aspect. So how do we complement these two things? Dr. Alam?
Yeah, thanks for that question. So that's actually a very heated ongoing debate, right, within the policy space. So just like, Professor Kelly laid out, there's a process, there's a cycle to drug discovery, right? And the same is applicable to policy. So, right, policy requires evidence, and evidence is got from data points. So there's a piece around, looking at large data sets and combining this data and getting insights, right? And that's a step in policy that's usually rate limiting, right? And then there's a step, also around some basic functions, right? Things that ChatGPT can do for you, right? An outline and a draft, right? And then that needs to go for public, into public participation. So there are these spots that we can plug into the policy framework, right? But one of the big ones is, sourcing good data. So across social media, across different news points, across different sites, so and which takes a lot of time and effort and money and expertise, right? So this is one quick way of getting the data centralized. And then obviously the second one is some basic analysis to get that conversation going. And then beyond that, then the other parts of the cycle where it can play into, including a policy is just a document till it's implemented. So also, doing case studies or virtual check-ins to see, what, or modeling, right, what the implementations of this policy would be in XY space, instead of, giving it 5 years to implement a policy and then see the outcome. So, classical example was COVID, right? There was all these issues around social distancing and lockdowns and what those effects could have been. But in reality, if we had policies in place beforehand, we could actually have modeled some of these impacts in real time with real data. So I think that's it. And a policy is obviously a living document. So again, there's this piece of AI that's, very interactive and reactive. So it can, feed into this cycle very, very closely.
Thank you so much, Dr. Alam, for that. Prof. Kelly, would you like to come in on this part?
So if I understand your question, it's how the way that we practice the discovery and development of medicine, how that can coexist with AI. Is that the understanding of the question?
Yes.
Well, first of all, I think I will say this. At the end of the day, what we're looking to do in the space of discovering new medicines and developing them is to bring efficiency to the processes. So in other words, how can we shorten and have a much more focused way of doing what we're doing? But secondly, what is also important, and this is not just relevant to the work that we do, is that we have to remember the basics that underpin AI. And these three basics are, first of all, and this is, I think, is very important for our continent, is that we have to ensure that we have access to affordable and reliable electricity, because we need these supercomputers that analyze these very complex AI models. And you can't operate like that if you don't have access to reliable electricity and power. And secondly, the challenge also is, obviously access to the internet. We have to have the digital infrastructure. But more importantly, if these things are in place, I'm assuming that there is access to power and there's access to the internet, is really data, granular data. So we have to collect data. You cannot do AI without granular data. These are very complex, huge data sets that you need. And so we need to align what we do from the perspective of ensuring that we can not only collect data, but also develop data sharing mechanisms that allow people that want to analyze genomic data, for example, that they can have access to that. One of the reasons why we are using AI in the way that we used it for our project is, first of all, remember, I mentioned this point, you need granular data, huge data sets. But in Africa, from the field of genomics or genomics in general, we don't have biobanks that where you can extract this kind of information. We don't have that. We don't have clinical trials where there's a genotyping component. So what we've had to do is use AI to leapfrog this barrier of limited data, and then use a technique we call transfer learning. So transfer learning is essentially a technique where these AI models that are developed and pre-trained on, new data sets, or they're pre-trained on some data sets to do something specific, a specific task. So you then refine those pre-trained models for a new unrelated task. So in this case, what we've done is, use transfer learning from the cancer field. Cancer drugs are the most well-studied drugs with a lot of data from in vitro to clinical trials. So the thing that we really have to do, if we don't want to miss the AI boat, as I call it, the boat is waiting by the river. We need to jump on it, but it will go if we don't get these three basics in place. And that's how I think that for people in my discipline, whether it's drug discovery or pharmacogenomics, that we need to be able to collect granular data and be able to share that so that it can be mined to really have the impact on healthcare. Otherwise, we're going to miss the AI boat.
And we certainly do not want to miss that boat. Herbert, I know your colleague, Anne, is also on the call. I'd also invite her to come on if she would, if you'd like to input on that question, or would you like to ask Anne to answer?
I'll give input to the question.
Thank you.
Yeah, I think what I did not mention is we're seeing also some limitations when it comes to the application of AI, especially on the nutrition dashboard that I've talked about. Because the data that goes into modeling this dashboard is health facility data. So we're missing out on the cases that did not present at the health facility. Yeah, so how are we looking at this? Issues of having complementary other sources. Currently, Kenya is running a very strong community health services, where we have community health promoters who have been taken up by government and currently are being paid. They're responsible for 100 households in at village level, so they do surveillance also. So we tend also to look at the kind of reports that are coming out from community health reporting, just to complement what we see in the dashboard. Secondly, we are not going to improve on human resource anytime soon. The kind of numbers we have in terms of healthcare workers is what we can plan and use. And we can complement that with the use of AI. The work they are doing, how can we make it more efficient using artificial intelligence? So in terms of how can these two work together, we recognize that there's limitation to both. The current reporting method, where we use just clinical data that presenting at the health facility, how many children are coming with malnutrition, and also now looking at how is AI using information that is available to predict and make this information available right now for decision making. So we are not going to say that we discarding all the other methods, but want to show by use of AI, there's a positive contribution in terms of time, precision, and also that element of cost that comes in when we use artificial intelligence, especially in health, and more specifically when it comes to managing malnutrition. Thank you.
Thank you so much for that. Those points really do show why these two things need to work complementary. Dr. Alam, I'd like to bring you in here. We are hearing from the panels and even during the presentations of some of these really exciting things that AI can do in health. But the issue is that we're dealing with people, right? When you're talking about health. And I think that's when some of these ethical considerations really need to come in. So I'd like to ask you, what are some of these potential risks and ethical considerations of using AI in this field of healthcare, and how can they be used to, to ensure that things are equitable in the healthcare space?
Yeah, thanks for that question, Anne. So rightfully pointed, right? There are lots of ethical concerns, right, around the applications of AI, right? So some of them, we've already talked about worsening inequalities, whether, driven, like Professor Kelly said, through, non-representation of data sets, gender. And so, obviously for data set, if AI application is trained on a particular data set, it can predict wrongly within a different context, right? And that is a concern in our context because, as we have seen, we don't have this representation through the data sets, right? And then obviously there's also concerns around patient protection. So misuse again of information or open data sharing, right? We've seen applications online and social media, pushing this deep fake news, right? So that's another potential, right? And especially in our concerns, for example, if we just look at the mpox, right, outbreak right now, there can be so much stigma associated with this. So that's another risk, right? That some of these platforms can just go and perpetuate these risks and then cause an issue down the road. So, and then obviously the regulatory risks that we've already discussed. So these are all ethical concerns that need to be thought through and addressed, especially within our context. So they're multifaceted, if I can say that. And then another big one, right? And I think that hasn't come up in today's context, in today's discussion, right, are the social determinants of health. So health is a very complex phenomena, right? And it's factored in. Economics factors it, all of a sudden, depending on what area you live in, and if there's, a climate catastrophe, all of a sudden you can become an at-risk person. And we know, especially, with the current debates, especially in the developed worlds, right, there is this focus on AI being used more for security, and not necessarily global health security, but security challenges. So again, in our context, right, in conflict areas and hard to reach communities, how does that play in, right? Are we just letting our people's identity? Are we, sabotaging people in cultural ways, right? HIV is a classical example, right? There are lots of diseases out there that have religious, not connotations, but religious boundaries to treatment or not, right? So how do all those come into play? I think those are the big ones that I can think of right at the top of my head.
Super important. Thank you so much, Dr. Alam. Now I'd like to bring in Prof. Kelly. Prof, you keep on mentioning, you keep on emphasizing the idea that data is so important for AI. So I wanted to ask, for somebody who is doing research at your level, how easy, and I say this in inverted commas, is it to get this data that you need to really generate these outcomes?
Thank you, Anne. Unfortunately, it's one of the challenges that we face, particularly in Africa. If I look at if we want to collect genomic data, for our populations, I think that we have to do a lot of community engagement. And part of the reason is historically we have this trust deficit, where, for good reason, people have historically not been involved in this process in the research and development. And I like to always give this example, and this is again important really for the education for our communities to be brought into this, for us to be respectful, not just of the cultures, but also to ensure that there is policies, as Dr. Alam was alluding to, first of all, to ensure that there is a data privacy and security that can assure people that when they share their data, that it will be protected, that it will not be misused. But also, I think it's important to also emphasize that our communities, our people need to understand that unless we participate in the research and development ourselves, we're not going to have the benefits that we desire. But secondly, there's a lot actually that we take for granted. And let me give you a practical example. When I was growing up as a little young man, young boy, not a young man, but young boy, I would go to, I was growing up in Zambia in the townships where you get down with malaria, you get sick. And I would go to the health facility, and the government of the day provided access to health facilities and medicines. So, I go to the hospital, the clinic, I get malaria medicines, I get cured. And if those medicines were not available, I would die. Malaria kills. Now, I took it for granted. I didn't even think about it. It's almost like I'm entitled to this, but without realizing that actually I took this for granted. On much later in life, did I realize two things. Firstly, that someone somewhere in the world invested in the research and development. I described this process in my presentation. It's long, it's expensive. It can cost billions of dollars. It can take anything between 10, 15 years. Yeah, okay. COVID it was a separate story. People say, oh, but COVID was quick. Yeah, but we can discuss that separately. But there's a reason, COVID vaccines were not formally approved in the normal way. We are in a pandemic, so what we got was approval it was emergency use. Yeah, so anyway, but the point is this: I took it for granted. I didn't know. Only much later in life, I realized that someone somewhere in the world invested billions and millions of dollars in the research and development to discover these medicines that I'm benefiting from. Secondly, and importantly, that someone somewhere, a fellow human being, typically from the global north, outside of Africa, where the trials were done for those medicines, volunteered to participate in the clinical trial for my benefit. Now, if we get that message across to our communities, they will begin to understand that, in fact, there are things we benefit from when other people have sacrificed, for us, So I think we just need a lot of education. And so this is a limitation to data collection. We need to bridge this trust deficit, respect our communities, but also really come down to the level where they can understand the benefits of them participating in what we do. But importantly, to assure them of the data security and privacy that is needed to protect them. Then they'll be encouraged to do that. Back to you, Anne.
Thank you so much, Prof. That's really important. And I think when you tell that story, maybe that's what needs to be told so that more people can understand that these things don't just happen. It does need people's input. Herbert, I'd like to bring you in over here. You spoke about the nutrition dashboard that's being developed, and you spoke on the idea that it's got the idea, it helps with planning. So I wanted to ask you, when projects like this have been developed, how important are partnerships with the government and yourselves as NGOs and the private sector to really strengthen health systems and really improve outcomes for people in a specific region?
Yeah, thank you. Partnership is key when it comes to, especially when you bring AI into application in health. Yeah, because what we're looking for is scale up of this kind of innovation. And the only partner that can do significant work when it comes to scale up is government. So the relationship with government is that we work on these projects, these programs together. Once they understand, because they're always afraid of AI. Every time you mention AI, everyone has their own definition of what AI is. So once they join into this program early on in the design and implementation, they tend to understand the benefits that comes into it. Then we do recognize that on top of the capacity that we have internally, there are also available resources that we can tap in. Other partners, there's already work ongoing. We came to realize that most of this innovation, if you look around within the country or even in other African countries, you realize that there's some work already done. But the challenge is there's no clear pipeline in terms of recognizing what is being done in Africa or even in Kenya alone. You can't tell exactly what is happening. So when we bring these partners under one platform, that you have an interest in artificial intelligence, in health, then we can tend to move faster. As expertise come in internally, we don't have to look far. Then through this partnership, we can put in resources that we have talked about. Sometimes it takes long and a lot of resources, but through this kind of partnership, then we can share the burden when it comes to development and also now the coverage. If you look at what needs to be done, especially when we're looking at this nutrition dashboard, we wanted to look at a lot of data from all the counties in Kenya. It was not easy. Organizing this together, you need approval from government. Approvals are always there. They need to understand what kind of data you're extracting from the system, how are you using it. But once all of them come on the same table, agree on what needs to be done, then moving forward is much easier. So I'm looking at how can we replicate this into other health intervention areas, as I had mentioned before. So this is an effort that is strengthening governance and collaboration and partnerships that can really benefit when it comes to issues of health. Thank you.
Thank you so much, Herbert. And I hope, using the nutrition dashboard, it can really be practical examples to get in more buy-in from government so that you can do more of this work. I know Prof. Dr. Alam quickly just wanted to add before we wrap up on the point that was being discussed by Prof. Chibale quickly on the issues of data and the challenges around it.
Yeah, so data has come up, like even in that first question, right? Herbert spoke about it, Prof spoke about it, I spoke about it, right? But another capability of AI that we haven't paid attention to is this ability to generate data, so what we call synthetic data, right? And then the synthetic data can be used to train whatever you need to train it on. But what happens, a scenario that can play out in the health space, linked to that first question you asked me around ethics, is that, if your model uses this data and there's a negative outcome, then ethically, who does the burden fall on, right? Is it the data set? Or is it the person who generated it? Or is it the person who went and used it? Or is it, the person who actually designed what the application was? I think that's another big, and I know this is another big area currently under discussions with the policy and governance space, and especially, then how is this linked to biosecurity and agents of bio threat? So I just wanted to bring that to your attention.
Thank you. I think that is a very interesting point. Especially as we move forward into these applications of AI. It's been such a thorough. I'd like to now ask our panelists to all pop up onto the screen as we are about to wrap up. Thank you all. It's been such an engaging conversation, and unfortunately we are limited for time. I would have loved to continue this conversation and ask more things. I also thank you for answering promptly the questions that were asked in the Q&A box. As we saw, AI and other technological innovations really hold immense potential for transforming healthcare across Africa. And as we move forward, I hope we continue to explore and implement these solutions to create a more equitable health system right here in Africa. From my end, it's been such a pleasure to be the moderator this afternoon. I thoroughly enjoyed this conversation, and I'd now like to ask Dr. Millie Piri, who's already on the call. She is the General Manager at the Conversation Africa, and she will give the vote of thanks.
Thank you so much, Anne, and I would like to thank all our panelists. Good afternoon. My name is Dr. Millie Piri, as Anne has already said, and I'm the General Manager for Conversation Africa. We started the dialogue series three years ago in an attempt to get policymakers and scientists around the globe around the table to discuss issues that are important across our continent. and to share insights and learnings, which could potentially lead to some solutions. We also wanted to give non-scientists the opportunity to participate in these discussions and learn from these experts and practitioners. And we think that our virtual events have been able to do exactly that. We have covered everything from COVID-19 to elections and insecurity on the continent, and we will continue to do more. So I'd like to take this opportunity really to thank each and every one of you, our panelists, for your time today. And it was such a great discussion. I really enjoyed it. And to thank our partners, GHS, and the Africa Health Tech podcasts, and you as participants for joining and being part of the dialogue. As I said, this is the first in a series of 4 virtual events that will be taking place over the next month. And we would love you to really come and join us in the 4 events. So check the chat box for more details. I wish you all a good afternoon. Thank you very much.
Thank you.